Hello everyone. Today we are going to talk about ulnar nerve. This is a picture of ulnar nerve, but yeah, let's go through this. So this ulnar nerve is a peripheral nerve that arises from the brachial plexus, and it's a continuation of the medial cord. So it consists of C8 and T1 nerve roots. So medial cord, you can see it comes as a continuation of the medial cord, and it lies medial to the axillary. It lies between the axillary vein and the axillary artery in a deeper plane in the axillary region, and then it continues into the arm, and thereby it lies medial to the brachial artery. So you can see it lies medial to the brachial artery, and then at the it comes to the midpoint of the arm. At the middle of the arm, it pierces the medial intermuscular septum. As you can see here, it comes to the middle of the arm and it pierces the intermuscular septum and then enters the posterior compartment of the arm. So as it enters the posterior compartment of arm, then it lies anterior to the lateral head of triceps brachii, to the medial head of the triceps brachii, and then after entering the posterior compartment of arm, it just descends down and then descends down behind this medial epicondyle uh, of the humerus. So at this point, this ulnar nerve can be palpated. It descends down behind the medial epicondyle. So you can see it. You can see it from posterior side, right, not from the anterior side. So at this point, it can be palpated. So after that, it enters into the anterior compartment again, while entering into the forearm through the two heads of flexor carpi ulnaris, and thereby it actually innervates the flexor carpi ulnaris. Uh, Actually, the middle half of it is innervated by flexor carpi ulnaris. And also, it's important to mention that here flexor carpi ulnaris, the ulnar nerve does not become a content of the cubital fossa. And then it gives out three branches: the muscular branches, palmar cutaneous branches, and dorsal cutaneous branch. So you can see the muscular branch here with this yellow arrow. It innervates the flexor carpi ulnaris and flexor digitorum profundus. So it's important to remember that um, as it descends downward in the forearm, medial. It lies on the medial part of the flexor digitorum profundus, and it descends downward on this muscle. Lies on the medial side of the flexor retinaculum in a okay. Now it as it descends down on the flexor digitorum profundus, it also innervates this muscle. So in the forearm, ulnar nerve innervates only two muscles, that is flexor carpi ulnaris and flexor digitorum profundus. The rest of the muscles in this forearm are innervated by medial nerve. So then after giving the muscular branches, it goes into the hand. So let's discuss what's the importance of these other two branches: palmar cutaneous branch and dorsal cutaneous branch. So palmar cutaneous branch is actually not shown here, but what it does is it gives to the superficial, it innervates the superficial layer of the arm, the medial side of the forearm. Then this is the dorsal cutaneous branch. So as you can see, it passes from the anterior side and goes into the posterior dorsal side of the hand. So it innervates the superficial skin of the dorsal side of the hand, and then you can see as it enters into the hand through the flexor retinaculum, from the medial side of the flexor retinaculum, and in a separate canal called the Guyon's canal. This Guyon's canal is covered by uh, the volar is covered by the volar carpal ligament, and thereby again this ulnar nerve is not a part of this cubital is not a part, it does not become a part of this carpal tunnel here, because it lies on the medial side of the flexor retinaculum in a separate canal called the Guyon's canal. So after entering through the Guyon's canals, it gives at the pisiform bone, it gives out two branches, deep branch and superficial branch. So superficial branch actually supplies the uh, superficial skin of the palm. The deep branch supplies several muscles that includes hypothenar muscles, that means extensor digiti minimi, and then flexor digiti minimi and abductor digiti minimi. And then the medial two lumbricals, the lumbricals of the medial side, that means the lumbricals that belongs to third and fourth fingers, fourth and fifth fingers, the medial two lumbricals, and then the adductor pollicis muscle is also innervated by the deep branch of ulnar nerve, and then the four interossei are also innervated by the deep branch of ulnar nerve. So the superficial branch, medial one and half of the fingers, uh, surface skin of the medial half and one and half of the fingers is innervated by the superficial branch. So you can see the medial one and half. Medial one and half means this one finger, and this half of the fourth finger is innervated by the superficial branch of ulnar. So it provides a sensory function as it innervates the superficial, as it innervates the surface of the medial two and half of the fingers. So thank you for listening. This is the ulnar. Please comment in below to improve, to help me. Thank you.